Welcome back to another episode of the Vet Worthwhile podcast. I am James Yost, partner and wealth advisor at Signature FD, and I'm joined as always by my co-host Travis York, owner of 3-1 Advisors. Travis, how are you?
I'm doing great today, James. How about yourself?
I'm doing well.
All right, we are back with another episode of the Vet Worthwhile podcast. Travis, how are you, sir?
I'm doing well, James. I feel like it's been a little while since we've been at this.
Yeah, been a few weeks since we last connected. Super excited about the content we have today for our listeners. Why don't you give them a little insight into what we're going to be talking about?
Yeah, well, I mean, this is probably of all the episodes, I was actually joking before we started that I may go back and listen to this one, but we've got Dr. Scott on with us today. He is a fellow podcaster, so a little shout out for his podcast, The Vets Unleashed, if you have not listened to that. He is also a veterinarian. I think both you are practicing right now. That's correct, Scott?
I work for industry now, so I'm an industrial veterinarian.
Okay. So, I mean, he's really worn every hat in veterinary medicine because he's been an emergency doctor, a GP doctor, and now he's on the industry side of things. Along with that, he has a Master of Business Administration in operations, and most importantly, a passion around time management, which is really what he's here on with us to talk about today. And we're really excited to get his take on it because as he was educating me before the podcast, it's not just a passion. He's actually unpacked the science of time management, which is probably further than anybody else that I know in their interest and their commitment to learning more about time management. So welcome, Scott.
Thank you.
Maybe, just kind of kicking things off, can we just have you start and tell us, you are obviously a man of many skills, but where did your interest in time management start? And as a veterinarian, how did you step back and say, hey, like this whole thing of time management is something I want to invest my time into?
Yeah. And I think to start, the science of time management and medical work interruptions, which are sort of is my real passion, it is sort of a burgeoning or a new science in human medicine. And as you know, things typically take 5 to 10 years to sort of filter over here. So I love that I'm on the forefront. But if you look back, I would say, I always tell the story, and I've told this on several of our podcasts on the Vets Unleashed as well, where in undergrad up in northern Minnesota, I got my biology degree. And, through undergrad, I sort of learned how to study, I would say. But in terms of time management and truly being organized and all of those sort of arrangement aspects of time management that we talk about, I didn't really need to rely very heavily on that because school was fairly easy, right? I loved my science classes. Things came fairly easy. I didn't feel like I had to be prepared in order to succeed in my undergraduate degree.
And that's an awesome statement because I feel like that happens so many times, right? Like even in my own life, like I recognize, like I would recognize and say, like, again, like totally unrelated, but just on the whole time management thing, like now all of a sudden I've layered in, career, personal life, and 3 kids. And I never used to even have to like take a notion of time management because it came easy.
Right.
And I think that's such a great call out for our listeners.
Yeah. And whether it's, thankfully, I do not have 3 children, but for me, it was grad school where when I went to Iowa State and started my veterinary degree, all of a sudden I realized that, it's not like any of the concepts or the material was any more difficult than in undergrad, but there was so much more volume that if you weren't organized, if you weren't prepared, and if you didn't stay on top of your studies, it was very easy to get behind. And so I would say that's when I first started to dabble in, what we would consider one of the 3 essential tools of time management or essential aspects of time management, which would be arrangement. Like, started the to-do lists and, just keeping, for me, if I walk into my home and it's clean now, it just puts me in a place of being ready to take on the chaos of the day. And so it was
one of those 3 essential tools.
Yeah. And I mean, it's interesting because so many people, when you, like, I'm sure most of the folks who've logged into this call today, they're already thinking that I'm going to be talking about tricks and apps and life hacks and using AI. And that's an essential component of time management called arrangement. It's the 3 A's. Arrangement is all of that stuff, where the other and the first is called awareness, which is just an understanding of time, an understanding that time is a limited resource, and we're not really managing time, right? Time is always progressing forward. It's always carrying us along. We're really managing how we relate and interact and prioritize things in relation to that time that's, that's always marching forward. Then there's that arrangement again, which is the things that I first started dabbling in, creating habits that ultimately lead to more productivity and, hopefully not forgetting that you have an exam on Thursday, those kinds of things. But what's interesting is, and I love, my podcast partner and I have a series of 4-hour business management talks. And the last hour I do is all arrangement, fun life hacks, because if you've sat through 3 hours of the science of time management with me, it's fun at the end to teach veterinarians how to more effectively manage email and their email inbox and why to-do lists don't work, what the science behind that is, all of those kinds of things. How to use things like Scribe EI to write your notes and, come up with your differential list to save time and be more efficient. But every veterinarian I know who's been to any time management talks I've seen at major conferences, they go in and I think they're expecting to find that one thing that's going to make them more productive. You go in and most of these talks are on that second concept, which is arrangement, right? How do we arrange things and organize and what we call time management planning to be prepared for our day. And every vet, including me for years, sat through those talks and I would think, those are all great things and I can try and work on creating these new habits and, and all of this, but veterinary medicine is a dynamic system, right? And in my ER, the last ER I worked in, it was very common to walk into absolute chaos. The reality is that in veterinary medicine, in these dynamic systems, any type of medicine, you can do all your time management planning, but the minute a dog that gets hit by a car walks in the door, everything changes. It interrupts all the patients you're currently seeing, and all of a sudden that becomes your priority. And so what I've been focused on is really that third and final essential skill, which is adaptation, and what the science behind that shows for early career veterinarians. I also think these are important concepts for, sort of more seasoned veterinarians like myself who may be mentoring a younger vet to understand sort of where they're at. And rather than having to essentially make every mistake in the book to learn these skills, can I teach them up front some basic time management skills when chaos ensues, a system, if you will, so that they feel more in control of their day, even though we're constantly getting these work interruptions and constantly having to triage and reassess our patients in the hospital.
Dr. Scott, this is super fascinating from our perspective. And you talk a little bit about the research and the science and the data behind all this. I'd be curious if you have any data or information that would be useful to our listeners. Specifically, what I'm thinking of is like, of all the associate DVMs out there who are practicing, how many of them think that like time management is something they need to be focused on versus are they prioritizing their technical skills or their patient skills or whatever? Like how much of a pressing issue is this in their mind? Because what I've found in a lot of areas, like until somebody's ready to make it a priority, it's really difficult to convince them it should be a priority.
Right. Well, I think for the most part, and I believe this is very true in human medicine as well, I think that it's not part of most or honestly, probably no veterinary programs and very few MD and DO training programs where they actually even talk about time management. So there are no studies that I'm aware of that actually look at veterinary students' perceptions of these time management skills. But I think the first step and why it's so important to have opportunities like this for me to speak about it is to talk about, first of all, what is it and why is it important? Because again, I think most people assume that I'm just going to teach them how to make to-do lists and prioritize things, which is not, that area I focus on. The other is, you need to understand there's one study that I'm aware of that talks about, in human medicine, talks about teaching time management skills to residents, and then they followed them through their program. And really what we find is, truly the time management we're talking about in a clinical setting is going to give you the tools. Again, it's things that as a veterinarian who's practiced in clinical situations for many years, I've sort of learned how to do these skills, but I never had a formal process in my head. It was never taught. But what we know, some of the initial work in MDs that have been done shows that if you take a group of residents and you teach them some of these basic skills early on in their career, and then you follow up, first and foremost, they seem to thrive. They did better in their residency programs than the students who were taught these basic skills up front. And this was a half-day workshop that they did. But ultimately, it led to increased career satisfaction, burnout and attrition rates went down. And so those are benefits not just to, certainly burnout and career satisfaction is something that's important to veterinarians as well. And it's a benefit to employers too. So ultimately, I think you can even make the argument that, all those things also lead to better patient outcomes. And so that's, it's a win-win-win.
It seems like it's kind of a common denominator when you think about talking to hospital owners all over the country, if you were to rank their biggest challenges, doctor shortage, increased volume, stress, burnout of the staff, all these things, it seems like if everyone were able to better manage their time and better manage their stress because their time's better managed, that it would just create a much better, more symbiotic relationship and much more harmonious practice life than what we have today. So it sounds like, that's kind of what you're trying to accomplish.
Absolutely. And especially for early career veterinarians, newer graduates, to have a system in place. If I look back over my career, how much time in my early years I worried, sometimes needlessly, most of the time needlessly, about what might walk in the door. Am I ready? Am I prepared? I've never seen a GDV, and I've been in practice 6 months. What's going to happen when I do? Just having a system, a simple system, and being trained on it, there's power in that as well.
Very interesting. So, Scott, I just got to and I may be off base here relative to the system, so redirect me if my question isn't appropriate, right? But I heard you talk about kind of the three essential pieces, which is awareness and then adaptation, and a system to manage that adaptation. Yep. You also have talked, in just some of our conversations around, chaos ensues, right? Quite frankly, chaos ensues inside the four walls of the veterinary hospital. And even today, I think more of our veterinarians, because they're actively involved in home life and other things, are managing chaos elsewhere. Mm-hmm. How do you connect the awareness component to know that chaos is happening, catch that breath to then apply your system?
Yeah, and so that's where you come down to. So what we consider, there's medical time management, or time management planning, which is essentially planning for the day as best you can. And then in a dynamic system, when chaos happens, there's what we call contingency planning, which is very different. The idea of contingency planning, it's not going to be correlated with the amount of unpredicted work interruptions you have, right? So it's really designed to lessen the impact of these unforeseen events. So where we go with that, a lot of the new research looking at productivity in human medicine and also just in business has been sort of focused on, time management planning and all these things you can do before, but it really doesn't address the chaos. So, every veterinarian, I think every person on this planet knows that, has an awareness for the fact that that chaos and things happen that we can't control, oftentimes that we'd prefer they don't happen. And so some of the newer research has really shown that, essentially contingency planning, what you do when after that chaos happens to lessen that impact, that can have an impact in these medical systems. So again, where I went is I sort of took that. And I don't know if this is directly answering your question or if you're interested more in talking about sort of, the proverbial work-life balance, because we can go there too. But in my mind, I'm a veterinarian, right? I was a clinical veterinarian for over a decade, in addition to the other things I've done. My passion is really about how can I take these concepts and bring them back specifically to vet med and to help younger grads to learn a system that I didn't learn the easy way. I learned the hard way.
Yeah, well, and I think even more where I was going, Dr. Scott, is how do you even have the awareness to know that the chaos starts, right? Like sometimes I feel like I talk to veterinarians, especially in some of the ER environments, and it's like all of a sudden they're in the middle of chaos and didn't even, like it started and you didn't even have the moment to pause or the awareness to pause and say, hey, here, I've got this system and I've got this bag of tools that I can go tap into. So I was really interested in like how you just over the years have built skills to have that awareness that the chaos is ensuing.
Yeah. I mean, I think I have a memory of me walking into Southeast Portland Animal Hospital, which was my ER. And the place was like, ER, the TV show back in the day. I can remember walking in and seeing two different tables where they were actively doing CPR on an animal, and another group, another team, and our surgeon going into surgery in the back, and just, trash and bloody gauze on the floor everywhere, and nobody had time to clean it up, and people screaming and yelling out codes. And, in that respect, I think, it's, most people walk into that and it's like you feel the chaos, you feel all that energy. And interestingly enough, we now know as well that, this idea of contingency planning, it really does work in a chaotic system. So there was some question as to whether or not we really could do anything, but you feel it. And I would say take a step back. If you wonder, do I work in a chaotic environment? What you really need to think about, I would say, are two things. One is work interruptions, right? So how many times during the day are you doing something as a veterinarian, as a vet tech, as an office manager, as a CSR, and somebody else asks for your time and they interrupt what you're currently doing in that moment. So one of the studies looking at business found from the University of Illinois at Chicago found that knowledge workers, so it's a broader category than medical workers, but typically in an 8-hour workday, over 2 hours, 2.1 hours of their time was dealing with daily interruptions, right? So the first thing I would say is, how often are you interrupted at work? If it's a lot and you don't expect those interruptions, that's chaos, right? Yeah. And then the other is, how many times are you treating a patient? So you're actively providing patient care and you have to step away to do something else that all of a sudden becomes more pressing in that moment. Because in veterinary medicine, unfortunately, we're a limited resource. We don't have unlimited resources to treat every patient, where if you're in an ER, and, even my last ER with 11, 12 ER doctors, there were times when we were all working on something and another thing came in and we didn't have the luxury, particularly during the pandemic, to send it somewhere else. You have to make it work, right? We know that when we have a medical work interruption, if we don't have a system in place, and that's where we look at these time management concepts, we know that the outcome for that patient whose medical care is interrupted is suboptimal. We have more medical errors, we have more adverse events, more issues as a result of that medical work interruption.
So talking I think we want to dig in a little bit here, if that's okay with you. I would just love to know an example, speaking specifically about the contingency planning that you've mentioned, and something unexpected happens, which it happens every day inside of every veterinary hospital in America. Mm-hmm. What is an example of one of the concepts that you work with folks when you're doing your training on? What's an example of something you would coach them on to control that unexpected thing that's going to happen every day?
Yeah. Yeah. So we actually have a great exercise for the workshops that we've organized. And essentially it's almost like a card game, right? We deliver and you'll get maybe 2 or 3 cards. So imagine you're a new vet in the first day of your internship. And within the first morning, these are the 3 cases that walk in the door. And let's imagine to start, you get an hour with each one, right? So maybe it's a vomiting dog that you're going to take some x-rays on and do some treatments. And then we have a laceration that needs to be repaired surgically. So we have these cards, and then so we imagine them with their day. And then we randomly throw an emergency that's going to be, sort of a higher priority on the table. And we walk through these techniques. So I have to give a shout out to my podcast co-host, Dr. Mike McClenahan, because he helped me. We sat down and I said, here's the steps. The idea behind this, and this is sort of my, I don't know if it's patent or copyright. I got to figure that out yet. But these are my penned techniques. And I became very obsessed as well. Are you familiar with Atul Gawande?
Yeah.
Amazing. I saw him speak on his book, The Checklist Manifesto, at Stanford a few years ago. And he really inspired me. And I'm a big fan of checklists now. So I created a simple checklist that people can remember in their head. So if you're treating this case and you have to step away, nobody wants to run and get a clipboard and say, let's go through the checklist. It has to be something simple, easy, in the moment, where you can have the conversations as you're transitioning care from one patient to, one that needs your care more than the one you're stepping away from. And so we came up with timber, lumberjacks cutting a tree.
Dropped timber. 8 trees last week.
Yeah. So I'm glad you're still here.
Yeah, I made it.
Yeah. So timber, the E is just a placeholder to make it into a word. But here's where we go. Again, easy things that you can remember and you can train a team, because these are all team events. Very few of us are doing solo, vet med anymore. So timber, TIMBR, T is triage. We know how to do this. Our techs know how to do this. A lot of the customer service representatives are good at triaging as well, understanding that obviously animals that are, in a very critical state are going to be treated more quickly than animals who are not. So we're going to triage first. And there's a whole system in place that we go through with new grads to teach them triaging and the importance of this system. But the very next one, the I, is impact on the patient. So let's take, for example, you wanted specific examples. Let's say we have a little dog that was at the dog park. I'm not a dog park fan. You do ER work long enough, you suture up many, many dog bites and put in drains and, over the years that I just think not a fan of dog parks. So we've got a dog that was sweet little dog that went to the dog park and got bit and has a laceration that needs to be sedated or anesthetized and cleaned up, drains placed, explore the wound, that kind of stuff. All of a sudden, a GDV walks in, a twisted stomach, a bloat, and we have to go to surgery. That is immediately more life-threatening. So we've triaged that patient, and this is our priority. The next, the I, is what is the impact to that laceration patient if we put it aside because we have to, right? This is not an option. And again, how can we lessen the impact of this unforeseen GDV in this other patient? So talking through it really quickly, the I is what is the impact? Well, maybe that wound is bleeding. So we might need to put a bandage on it, right? To stop the bleeding or control the bleeding until we can deal with it. They're probably in pain. They probably have anxiety and discomfort. And now we're going to make them sit in a kennel while we deal with another more pressing case. So could we use anxiolytics? Could we give the pre-meds early? Could we give some pain medications to help? All these kinds of things. What is the impact of delaying their care even a short time? And then from that, The M in timber is going to be our medical plan, right? So that's where let's have the technician in place a bandage, start the pain meds, place an IV catheter, maybe an anxiolytic to help with the stress of being in that environment, put a bandage on, maybe start the antibiotics as well before we actually go in. All right, so now we've got the T, the I, and the M. The B, I still think is one of the most important of this acronym. The B stands for buy-in because you're working with a team. So, I mean, as a vet, there's nothing more humbling than thinking about my career and how many times, if there wasn't a highly qualified veterinary technician or tech assistant that was there with me who felt comfortable enough to say, I don't know, Dr. Scott, did you think about this? Or this doesn't feel right. I mean, they save my butt all the time, right? You got to rely on your teams, and you have to make sure that we have their buy-in. So typically, at least in an ER setting or in a lot of clinics as well, whoever's providing the care for that patient when the medical care is interrupted and you as a doctor step away, asking them, does this make sense? Is there anything I'm forgetting? And technicians, boy, no one is better about telling you, I don't think the pain management is enough, right? Mm-hmm. Or, what about convenia, right? Like maybe we should give a convenia shot now. Oh, that's a great idea. So getting the buy-in from everyone. And then the final R is because this is a dynamic system, if something else happens, always reassessing, right? So maybe we have a medical plan for this patient, everybody has buy-in, and then a third, even more critical, an animal that's not able to breathe, that's choking, something where everything has to be drop. And then suddenly, now what went from maybe delaying this laceration repair an hour to delaying it 3 or 4 hours, who knows how long it'll take to, save the dog who's choking, get the racquetball out, and then go to GDV surgery, and then come back to this. So now that we've had, an even longer delay, should we reassess? Maybe, for some types of lacerations, not bite wounds, but, maybe we've missed that golden window and we can't just close it simply anymore. We have to go in now with this wound and anesthetize and trim the edges before we can close it. So, all those considerations, constantly reassessing, constantly, again, it's not so much that you're managing time, you're managing your patients and ultimately creating a system where those outcomes are going to be optimized when we have these medical work interruptions.
It's taking something that a lot of people, you try to manage it without a system, and it gives you a step-by-step process to effectively break it down and feeling it ultimately in control and probably reduce just stress and anxiety for the doctor themselves and then also ultimately for the team.
Yeah. It's that, even people, I've taught these skills to people who said, I don't really see the value in this. I think this is just common sense. But once you step into that role, as a younger doctor, I think to really fully understand, there's just confidence in knowing I got a system for this and I have a team. It reminds you there's a team in place too. There's going to be buy-in. We're all doing this together. We're all in this together. And I have a system when this occurs, is incredibly empowering.
I have a question, Dr. Scott, that I think you, and I know we're kind of running out of time here, back to the time management piece, but would love to, he says, sounds like a lot of the research and stuff came from the human medicine side. And this is, after all, a business. A lot of what we do is focused on the business of veterinary medicine. So would love if you can connect the dots and try to help our listeners to understand what the opportunity is here for them. So is there any data on percentages with respect to production or something like that when you implement these time management systems for human doctors or veterinarians? I don't know if you have those numbers, because, I think that's something that, going back to what your point was of value, it's a very vague thing, but if we have hard data and hard research on what the value of implementing some of these time management techniques, that's something I think our listeners would love to hear.
Yeah. Well, I would put a call out to anyone listening that might be at a veterinary school that's willing to do some collaborative research with me. It is desperately needed. And again, I think a lot of the work interruption and adaptation work that's out there is in business. So certainly there's evidence in the business world with attorneys, with, sort of retail-based businesses where there is a cost benefit to these. But in medicine, it really is sort of a newer science, and there is a desperate need for more research. So the limited research that's there really looks at outcomes and not the economic impact of those, medical outcomes. So I would say we still have to make a leap of faith, but I think most of us in medicine understand that if we have less, say post-surgical complications or less medical complications from our treatments and better patient outcomes, that's probably better for business in the bottom line.
Absolutely.
But again, it would be the first thing I would love to do is perform a very similar study to what was done with human residents. I would love to take a group of veterinary residents in a structured program and teach them these basic time management skills with a survey up front and then a survey sort of in the middle and at the end of their residency, and see if there's a statistical difference in how they answered the questions, how they performed in their residency, specifically with regard to those things we talked about: career satisfaction, effectiveness as a veterinarian, burnout, and ultimately completing the program, how many cases they see, all of those types of things, which have a direct economic component. And then I think the next step would be some studies that actually look at the business aspects. But again, I think initially what we have to look at is primarily, for an employer or for someone who's more a management person, to make your younger vets feel empowered and like they have a toolkit to handle, the proverbial, feces when it hits the fan. If they're ultimately going to be happier down the road, that's better for business. And if patient outcomes are better, that's going to be better for business. But no, huge opportunities for additional research in this.
No, awesome. This has been great and super exciting. And obviously, I think we could probably sit here for the next couple of hours and talk about this. But in the name of time, I know we'll probably lose some listeners and lose impact. I guess kind of two follow-up questions as we start to kind of wrap this up, Dr. Scott. Let's say somebody listens to this and they're like, yeah, I absolutely, whether it's across their entire hospital or at a personal level, really is interested in this. I'd love to have you, kind of talk about a first step that an individual could take in doing this, and then where they may go to either connect with you to learn more about it or just in general find some reading or literature so the scientist in them can find the validation, maybe before they take that next step.
Well, and that's where I would say it's always interesting. I've compiled a set or a list of resources for people, and I'm happy to, we don't have it posted on our website right now, but I offer that for anyone who attends our time management workshops or when we give our talks. Like I have a 4-hour practice management module series. I'll go through them. I would say it's interesting because you guys are clearly medical futurists, right? You're way ahead of where the current research is. And unfortunately, there truly is just a couple studies from the MDs, and then you have to pull the business studies in with a few of the medical studies that are out there to kind of create the picture. There isn't one great book. I've read a couple books written by doctors, medical doctors, on time management. They aren't real great. So I would say the places to start are simple things. There's an article that I'm happy to provide for you guys to post, which is a gentleman in Chicago who does a lot of research on this. And he just summarizes the Harvard Business Review's. Essentially, they whittled it down to those 3 essential skills. Read that and get a basis and an understanding for where to go next. And then I think most people, if you're still interested at that point, you're probably going to go into areas where you read a couple books on time management. And I certainly can recommend a couple for your listeners. Also, some really good books. Atomic Habits was one that I find useful. I'm not a psychologist, but I know I am a procrastinator, as many veterinarians are. So I love that book because it gives you real world ways to make changes and create habits that are going to ultimately lead to all those arrangement things, which can be amazing, but you have to do them. right? And then, other books, there's a book, I think it's called the Work-Life Balance Myth, which is a really great way to address some of those other aspects that you talk about. There is chaos in other areas of our life. So that's a great one to really say, first of all, it truly is a myth. Nothing is going to be fully, perfectly, beautifully balanced all the time. That's just not the life or the career we chose. But simple things like adding in one of these 7 absolutely essential areas can make a huge difference in your personal happiness and your well-being as well. So those are probably the areas I'd start. And if you're loving it and want to totally nerd out on the operations and time management science, then I'd say reach out to me by the time you get to that point, and we can get our nerd on, and I'm happy to share all those papers and studies with you. I think the people that get through to that point are probably going to be few and far between, and I would want to know them.
Love that.
Well, I don't know, James, if you have anything else. In summary, I'm just excited that Dr. Scott was willing to take a little time and sit down with us and share this information, because obviously I think it can really have a positive impact and probably address one of the greatest concerns we keep hearing from practice owners, which is how do we just generally de-stress the operations of our hospital?
Yeah, absolutely. It's been fun. I've enjoyed having the conversation with you guys, and maybe we can get you on the Vets Unleashed podcast as well.
Always happy to do that. Always happy to share anything that you think might be valuable for your listeners. Now, before you jump off, Dr. Scott, we always kind of conclude, and if you listen to Megan, you kind of know what's coming. There's a quote that says, everyone wants to change the world, but no one wants to change the toilet paper roll. So it's kind of a 2-part question. One, have you ever snuck out of the bathroom without changing the toilet paper roll, or are you consistently always making sure you get that done?
I would say I'm kind of a Boy Scout when it comes to those things. I'll even put other people's shopping carts away at Trader Joe's, the grocery store. I'm a taskmaster too, so I like to, for me, there's satisfaction in completing tasks. So it's not so much about, I'd like to say that I'm so kind that I replace the toilet paper roll because, I'm thinking about and empathetically rationalizing it's the right thing to do for the next person who needs it. But I probably do it more because it's a task and I can just do it easily and be done with it. And that's rewarding to me.
Nice. Well, the final question is always a lot more fun. It ties back to, so for our listeners that want to change the world, what's the one piece of advice that you would give them?
I think, especially in today's environment, post worldwide pandemic, I think be kind. Whatever you do, be kind.
I love it. It's timeless. It's universal. It's beautiful. I love it. All right. Well, this has been another episode of the Vet Worthwhile podcast. Dr. Scott Weinman, thanks so much for joining us. Everybody have a good day.
Thanks again for tuning in to the Vet Worthwhile podcast. You can find us online at signaturefd.com/signatureveterinary. And then our ask would be, if you found this episode valuable, just think of one friend or colleague that you think would enjoy the content, and just please share. So thanks again. We'll see you next time.
Travis York is the owner of 3-in-1 Vet Advisors and a partner of Signature FD. 3-in-1 Vet Advisors is a veterinary consulting and strategic planning firm of which Signature FD has no involvement or ownership. James Yost is a partner and wealth advisor at Signature FD. Signature FD is an investment advisor registered with the U.S. Securities and Exchange Commission. 3-in-1 Vet Advisors and Signature FD are not affiliated. Mr. York provides all non-investment advisory services through 3-in-1 Vet Advisors. The opinions of the guests and the contents of this podcast are intended to be educational only and should not be relied upon as investment, tax, business, or planning advice. You should consult with a professional advisor prior to taking any course of action that may impact you or your business.